We're going to go over a little bit of a wrist functional anatomy. I had a patient who, actually a client, who's a training client, who has been having some wrist pain on his inside part, pinky side of his wrist. And the pain is when he flexes his wrist and bends it towards the pinky side, or what we call ulnar deviation, okay? So what we found was we have to understand the anatomy of the wrist. So this bone over here, the outside thumb side part of your wrist, this is the radius. The pinky side, this is the ulnar. As you can see, just in general, with the palm facing forward in this supinated position, the radial bone is generally longer relative to the ulnar bone over here, okay? The significance of that is when I do the side-to-side motion, if I move my hand and my wrist to the thumb side and then to the pinky side, because of the long radial bone, I'll have less motion in radial deviation or towards the thumb side, and I'll have somewhat more motion to the pinky side or ulnar deviation, okay? Now, there's less space over here because of this long bone. That's why there's limited motion. Now, when I turn my forearm and have my palm facing back, that's called pronation. So now that radial bone actually shortens. So now there's more mobility in radial deviation or towards the thumb side. And relative to that, there's somewhat less motion or less space, because if this gets long, the radius gets long, the ulnar gets short. Relative to that, I'll have less space into ulnar deviation. So this client had pain with flexion and ulnar deviation, okay? And the pain was the inside part of his wrist. Now it's because all the muscles on the inside part of his wrist, the pronator muscles, the wrist flexor muscles, the tennis elbow muscles over here, inside part of the forearm, were overused, hypertonic, and adaptively shortened. So, taught him some quick pin and stretch soft tissue work here to open up this area to create space. And then, I'll show you in a bit, showed him a wrist extensor, supinator, radial deviator strengthening exercise to oppose that. Pretty cool. So you take a kettlebell with the handles facing you, take it in the same position, put it between your legs, and then you're just gonna let the fat part of the kettlebell go down so you feel a stretch on the thumb side of your wrist, okay? So what you're gonna do is, from there, you're gonna lift the kettlebell like this, okay? So you extend, feel the lengthening, feel the tension, and then contract, and you're gonna feel your wrist extensors, radial deviators of your forearm and wrist, okay? And this is the motion. Okay. Generally high reps, 15, 20, 25, 30 reps. This is a 15-pound weight, but generally, depending on the size of the individual and the symptoms, anywhere from 10 to 25 pounds.